a lot of our other faculty members and serves as our kind of faculty lead pre-health advisor as well. And so that's the other person that you see on our screen. And I would love if our ambassador who's joining us today, Anna Sophia, can you introduce yourself to the group?
Yeah, hi. So I'm a student ambassador. I'm just kind of here to give you like the student perspective on things a little bit, just a little bit about me. I'm also from the Seattle area. I'm a senior now. One of the things that's a little bit different is a lot of pre-health students tend to be either like a science or like a STEM major, so like biochemistry. I'm actually a psych major with minors in women's and gender studies and religious studies. So it's kind of a weird mix of stuff. But if you guys have any questions about like the student perspective, like homework, classes, time management, extracurriculars, or like involvement, I can answer those questions for you too.
Great, thanks, Anna Sophia. So we are going to go through a few bits of content here, but really want to make sure that we're answering questions that you all have about Gonzaga and specifically about health sciences. And if you all are here because maybe you're interested in going into things like medicine, dentistry, physical therapy, other health professions fields. So we're going to go through a little bit of content, but then really hopefully we'll get to some of your questions. So we first wanted to start with just some highlights here and some things that maybe make studying, health sciences at Gonzaga unique. So one is our Health Professions Pathways program, which is a little bit of a mouthful. So we abbreviate that as H3P here. And that is really our centralized pre-health advising. So that is in the Career and Professional Development Office, our career center here, but we work with so many people across campus to really support our pre-health students. And what that looks like is we do one-on-one individual appointments with students. We put on different programs. We invite medical schools and physical therapy schools to come to campus to talk to students about what they're looking for, what they should be preparing for if that's the end goal. We help students kind of get connected and come up with ideas for getting clinical experience, volunteering in hospitals, getting service experience, helping them with applications for research roles. And so helping them really with all of the preparation process. And then when they get ready to apply to school, so when they're applying to medical school, helping them with that process as well. So writing things helping them to write personal statements, get ready to interview, all those steps that lead into that. A couple of cool things about the H3P program. We also have some peer educators. So these are students that are hired and trained, and they support specifically our first and second year students. And so they are able to share their perspective as pre-health students, answer questions, especially for our younger pre-health students here on campus. And then we also have, I teach a 1-credit course that is specifically for juniors and seniors who are getting ready to apply to, again, those medical school, dental school, all those type of programs that helps provide some structure and resources for all of those things. Again, the interviewing, the personal statements, the application process. If you have not visited our website, that is gonzaga.edu/H3P. That has a lot of great information about H3P and the resources that we offer, as well as just kind of support through, again, that early exploration process into health careers, all the way up to tips for applying to school. Some of you may have heard about the University of Washington School of Medicine and the Gonzaga University Regional Health Partnership. So that's something that's pretty unique to Gonzaga, and that creates some really cool opportunities. We have several faculty members who teach both at Gonzaga and at the School of Medicine. So Dr. Measor is one of them. We have, I think, 3 professors from human physiology that teach at the School of Medicine. And so they're able to, share knowledge also. And for the Gonzaga faculty members, they're able to see day in and day out what it's like for medical students. And they're able to kind of bring back that experience and knowledge to our pre-med students and kind of share what that looks like. We also have medical students and also PA students that are basically right next door to our campus or on our campus. And so that creates mentorship opportunities. Specifically, one example would be University of Washington's Underrepresented in Medicine group does a lot of programming for our students who are interested in getting into that field. We have a lot of service, club, leadership opportunities for our PreHealth students. So we have several PreHealth clubs on campus that put on really, really cool programs to support students in those areas. Opportunity Northeast is a new program that has been put out by the university, a new initiative. And there are, I think, going to be some really unique opportunities for getting involved in service in the neighborhood and community right next to Gonzaga's campus. And then we have two new buildings that we're really excited about, and we'll go into the slides below. And then our human physiology program, which I'm going to let Dr. Crosswhite talk about in greater depth in just a second, because he is the expert in that area. So one of our new buildings on campus that we're really excited about and is going to be opening very soon is our Bollier Center for Integrated Science and Engineering. And so construction is moving really quickly. This is going to be housing kind of combined science and engineering space. So it is connecting our existing, one of our main science buildings and our main engineering building, and is creating a lot more lab space, study space, classroom space for our students. And so this is going to be just a really great addition to our existing facilities on campus. And then as part of the partnership with the School of Medicine has been using facilities on our campus, but they're building a new facility that's going to be kind of right next to campus. And they're going to also be sharing space with our human physiology department. So this is a really great opportunity to, again, just kind of upgrade the already great facilities. And I'm going to let Dr. Crosswhite kind of talk about some of the exciting developments there, and then lead into talking about the human phys program.
Thanks, Catherine. I don't have too much to add about the building besides, well, a couple weeks ago, some of my colleagues and I were able to go tour it. It's still under construction. So it was really fun to go in there and see our work and several years worth of conversations about designing lab spaces and teaching spaces for it to actually be going up. So it's really exciting. Right now we're on track for the building to be completed at the end of May. So this coming May, and I believe University of Washington will move in June, followed by our program, the Human Physiology program, scheduled to move in July. So our next academic year, we will plan on being in this building and utilizing the great new space. So we're really excited about this. It's going to really improve the amount of space we have, the resources that we have, and the space, and we're really excited about our students being able to be in the same building as medical students and MedX or PA students. So between classes, they'll be rubbing elbows and interacting with graduate professional students. So we're really excited about that. And Catherine, did you want me to talk about our program a little bit, or is there anything else we need to add about the building?
Nope. Sorry, I was trying to advance slides. Yeah, if you want to go ahead and talk about human physiology, and this is kind of a combined program that we're talking about today, but really wanted to be able to highlight human phys. So yeah, go ahead and jump in.
All right. Thanks. So I just want to take a minute and introduce everyone to our program. So human physiology is really a deep dive. I mean, you can see the words up there on the screen. I'm not going to read them to you. But really, if you want to think about it in a simple way, it's a deep dive into studying the function of the human body. That's what we do. It's pretty rare to have a dedicated human physiology degree program on an undergraduate at an undergraduate institution. So we're one of a handful programs around the country. So we believe that's very, very unique. Often where you see human physiology is housed within other degree programs like biology, and it's a concentration. So we're really proud about having a standalone degree. It really allows us to offer a wide variety of courses as it relates to the human body. For example, we have physiology of aging, or exercise physiology, or I do cell and molecular physiology. So it really allows us to give our students a wide variety of education on the human body. The other thing I'll say is that we aren't the only avenue for PreHealth students on campus. There are many avenues, like you heard your student ambassador. She's a psychology major with several minors, so I'm sure she's got plenty of things to do and study. But we're one of those degrees, as well as biology. There are many others, so just keep that in mind. Let's see. So we have, when it comes to, probably you're wondering, what can I do with a human physiology degree? So I advise about 35 students a year, human physiology students, and among my 35 advisees, their interests are all over the place. So as I was saying earlier, a good number of my students are pursuing, they want to go to medical school. A good number of them want to go to physical therapy school. Several of them are interested in being a physician's assistant, or PA. There's occupational therapists. There's students, more and more of our students are taking their undergraduate human physiology degree and going into advanced, or accelerated, I should say, nursing programs. And so it's really, that's one thing that we like about our program, why we are so proud of it. And is that if you want to work with humans, if you want to work in health sciences and focus on humans, our degree is a focus. It's a deep dive on the human body, and there's a lot of things you can do with it. And it not just professional schools. We're not just a route for a professional school. Several of our students are staying on the graduate side of it, meaning they're going to get masters or potentially doctorates in human physiology related fields to pursue careers in doing research or research and teaching. And then lastly, we have a good number of students every year that are going directly into the workforce. Trying to get in entry-level jobs with sports related companies, say Nike. We have a former Nike employee who's now a colleague here in our program, Human Physiology, and he's actually attending today, so we can ask him any questions too, Dr. Brad Wilkins. So it really just, this program is aimed to try to be as flexible as possible for all of our students' interests. And I think I'll just kind of cut it off there, but happy to take any questions about human physiology or just PreHealth in general.
Thanks so much for all that great info about human phys, and thanks for joining us today too, Dr. Wilkins. So we have some other slides prepared, talking a little bit more about, PreHealth at Gonzaga and some other, opportunities and questions, but want to make sure that we're answering your questions. So Alexa, are there any questions that are coming in? Feel free to float those to us, because we want to get to those.
Yeah, absolutely. So we've had a couple, and one I'll maybe tackle first one because it's about an application process of someone asking if these are programs we need to apply into, or is it open for students of a variety of interests. So any of the biology, chemistry, or human physiology PreHealth tracks at Gonzaga are open to all students. You do not have to apply into them, with the only exception being nursing, which we have a separate breakout room for. If you're interested in nursing, you'll want to leave that one and go, or leave this session and go into the nursing one, as that is a direct admission program. But any of the other PreHealth professions programs at Gonzaga are open to students of all majors. And then this is kind of leading into a couple questions we've had here that maybe Katherine can tackle, or some of the faculty, or even Anna Sophia, about being a non-science major and on that med or pre-med track, and really what does that look like as far as graduating in 4 years? And if you know you want to do pre-med, when do you think you have to decide, like when is the latest to decide what major you want to declare with that?
Yeah, great question. And I can start with that. And then, yes, if any of the faculty or Anna Sophia, if you want to chime in. So, the short answer is you can be any major and go into the various health professions. And really, we really encourage students to choose a major that they want to study, because that if you're more interested in that major, you're going to be more invested. You're probably going to perform better in those classes. The science classes that you're going to need for, preparing for those fields, they're tough. But if you are choosing overall a major that you really enjoy, you're probably going to perform better because you're going to be putting in more time. You're going to enjoy the material, and the various programs, whether it's, medicine, dentistry, physical therapy, they want students from different backgrounds. They want different perspectives because that's going to, make you all better providers. That's going to lead to more enriched conversations once you get to that other level. There are definitely classes that you have to take in order to gain admission to, whether it's a medical school, a physical therapy, occupational therapy. And they all have a foundation in the sciences, but they all look slightly different. And so students are working with their faculty advisors, they're working with, our H3P program, they might be working with our academic advising office as well. And so in terms of kind of when a student can make that decision or should make that decision of, if they're pre-med, it really depends. We have some students that come in and they say, and they know right away that's the path they want to go down. Our academic advising office actually puts together all of our first semester students' schedules. And so they can indicate that and say that they have an interest in going into a health professions track. And so that office will make sure that they're in some introductory science courses that will help them, start building toward working to the upper level science classes that they would need. And especially if they're in a non-science major, right, that they're incorporating those science classes. We have some students that decide later on that they might want to go into a health profession. And so for those students, I would say trying to incorporate as many of those classes as they can while they're here. But it is also, somewhat common for students to take time that they are not immediately going into a professional school. So if students are needing to take time, and take classes at a community college after, we can kind of help them figure out how to navigate that path too. So it depends on kind of their timing, and how much of that they can fit in at Gonzaga is the goal for them to do as many of those courses while they're here. And we try and make that happen. Would there be anything, Dr. Crosswhite, that you would add?
Not necessarily to the questions that you addressed, but there's been a couple popping up as you've been talking. So I can take care of those. So Rosie asks, like, how easy is it to change your major? Like Katherine mentioned, that first year really is designed to be flexible. You're taking a lot of core classes, university core classes, and a lot of the introductory science classes. If you just say, you don't have to know, oh, I'm going to be pre-med or pre-PT, it's just, I have an interest in health science, you're going to be taking very similar introductory courses, your biology 101, your chemistry 101. So that first year is really, really flexible to change majors, to change your decisions. Happens all the time. Probably about 50% of my advisees, my first year advisees, they're changing their majors, and they're, because they're getting into, they're getting that experience in the classroom, and they're seeing what they like and what they are more interested in, and possibly what they're less interested in. I would say as you get into depending on the program, your major, as you get into your sophomore year, that becomes a little more challenging to change your major without possibly needing to add an extra semester or something like that. It just really depends. It's kind of all over the place. But certainly I like to tell students that even though Gonzaga kind of encourages students, requires students to declare majors coming in, they're not stuck with that. And there's a lot of flexibility, and it's very common for students to change their major. Anna Sophia, did you ever change your major at some point?
Yeah, so I came in as poli-sci and international relations, and then I changed my major to bio, and then I changed it to a minor in bio. And now here I am, 7 major changes later. And yeah, it definitely, my advisor, when I first came in, said that it's best if you declare what you want to do by like your second semester of your sophomore year. But the last adjustment I made to my like major or like degree track was last semester, and I'm a senior right now. So there's a lot of flexibility. It's just really up to you and your time management skills, your ability to like organize your courses. A lot of people like me who have like changed their major a lot and want to stay within pre-med, they tend to take summer classes, or they tend additional courses at like a community college in addition to whatever classes they're taking here at Gonzaga. So it's definitely doable. It requires a little bit of extra planning and organizational skills, but that's what all of these lovely advisors are for. But there's a lot of different ways that you can kind of approach being a pre-health or a pre-med student. Like I said, I'm a psych major with minors in women's and gender studies and religious studies. So there's a lot of different perspectives to kind of take with it, and it's really up to you and your interest.
Awesome, great. We've got another question that I'm wondering if any of you can answer about the different study abroad opportunities that are available to students in the health sciences. And if you don't, I can also kind of talk about this too. And then if you all want to maybe share some of your insight, I will say that Gonzaga has a really robust study abroad program. We have about 63% of our students choosing to study abroad and having over 60 programs in over 40 different countries. So yes, students of all majors aside from nursing can study abroad for at least a semester and still graduate in 4 years. We have a really awesome partnership with the School for Field Studies that allows students to do undergraduate research as part of their study abroad experience as well. So there's a lot to do with that. And if you'd like to learn more about our study abroad program, I can put a link in the chat and definitely reach out to your admission counselors. But do any of our faculty or students want to share information or experiences they've had, either their own experiences or students or other friends that have had abroad experiences while being in the health sciences?
Sure. Just real quick, there's also, in addition to during the semester or in-semester study abroad options, Gonzaga has a very popular Gonzaga in Florence summer program, which is really popular with a lot of our pre-med or pre-health students, because sometimes your semesters get really busy and you've got a lot of classes. And so it's tough to pick up some of those pre-health classes at other universities abroad. So there's summer study abroad opportunities, there's in-semester study abroad opportunities. So yeah, it just kind of depends on the program. Biology, human physiology, it just kind of depends. And there's certain times throughout the students' 4 years that are more amenable or better opportunity, I should say, for studying abroad. It kind of has to be done with some planning and some intention, because you just want to make sure that you are staying on track if you're interested in that 4-year degree program.
Yeah, I would agree. Kind of the earlier, if you're even thinking about it, I would say bring that up with a faculty advisor. Another program that I've heard that is popular with our pre-health students is in Glasgow, Scotland. They have a class that is, they have a kind of well-known cadaver lab there. And so a lot of our students really have enjoyed that experience of going over there. So that's also been a popular one, in addition to the field studies program that Alexa mentioned and the Florence program that Dr. Crosswhite mentioned.
Awesome. So keep those questions coming. As you can see, we have a wealth of knowledge here. So if you have more, let us know. Also, if you feel comfortable and maybe a little bit of brave of unmuting yourself and asking them out loud, I'm sure we would all appreciate that as well. But maybe I'll pick on Anna Sophia a little bit while we maybe wait for some students to come up with questions of what would be your top 3 tips that you wish you would have known being a health sciences student at Gonzaga.
I think one of the things that would have helped me the most in kind of navigating everything is just to not be scared to ask questions, because a lot of the times I was like, oh shoot, I have to figure all of this out for myself. I would spend hours like looking through like course catalogs and trying to plan my own classes by myself, when every student, I'm a student ambassador, so I always give the spiel. As a student at Gonzaga, you get your own faculty advisor, and that advisor is typically within the field that you have designated that you're interested in. I came in as poli-sci, so I had a advisor that was not exactly pre-health. So I asked to change them, and I didn't know that I could do that. And that was just one of the things that like helped me a lot, is just to demand the things that you need and actually ask the questions that you're trying to figure out, because that's like what all the faculty is here for. Like they're here literally as your like support system to answer any and all of your questions. I also was going to study abroad, and then COVID happened, unfortunately. So, I mean, it was like a weird situation for my year or my class for studying abroad, but I made it like one of the first things that I did when I got to Gonzaga was I made an appointment with the study abroad office. I went in there and I was like, tell me everything you know. Like, I just want all the information. So you can start kind of thinking about those things, because the faster, or not the faster, but the sooner you kind of plan out what you want to do in your 4 years, the easier it is to get everything done. And the more support that you have from faculty and the different programs on campus. And it just makes it for a lot easier your senior year. It's less of a headache. One of the things that I also kind of wish that I'd known further in advance, I work at a clinic now off campus. It's like a work study job. And there are so many different volunteer or work opportunities, especially in the Spokane area. A lot of people don't know this about Spokane, but we're home to dozens of clinics, health centers, hospitals. And because we have a smaller student body, the opportunities tend to be more plentiful. So we have a little bit more like choice, or a little bit more just like a amount of things that we can be doing. There's more of them because there are fewer students. So just always be asking about what you can be doing. I just work as a receptionist / medical assistant, but I spent a summer training as like a translator. So there's just a bunch of different things that you can do to kind of get that perspective of what it looks like to be in the like professional or career setting. And it definitely has helped me kind of navigate or figure out what exactly it is I want to do. So
that was a great transition, Anna Sophia. And I don't know if you were like looking at the chat while you were wrapping up your answer, but the next question is the internship opportunities that Gonzaga offers to shadow or to be in the medical field. So could we have our possibly Katherine or Dr. Crosswhite talk about what are the services or resources Gonzaga has in place to help our students connect with those opportunities?
Katherine, you want to start us off and I can chime in?
Sure. Yeah. So as Anna Sophia mentioned, Spokane is a huge regional healthcare hub. We have like 6 major hospitals in Spokane, lots and lots of clinics. That's not even counting, over in Coeur d'Alene, Idaho, which is, about a 35-40 minute drive from downtown Spokane. And so we have lots of opportunities for students in a variety of fields. We also have a lot of the graduate and professional programs. So we have the University of Washington School of Medicine, we have Washington State School of Medicine, we have Whitworth, and Whitworth is going to be starting a physical therapy and an occupational therapy program. Eastern Washington, which is about 30 minutes away, they have several different healthcare programs. So between the practitioners and the graduate programs, so many opportunities for our students to connect with, current graduate students and providers in the area. So our students are going out and getting those experiences. We have, companies and organizations that are coming and posting opportunities. So I work in our career center and we have a job board. And so some of those organizations are coming and posting those, but our students are also going out and finding those opportunities as well. They might be, you know, finding those through connections through their class. They might be, you know, going after those and finding those through volunteer opportunities that are leading into those internships as well. So I would say it's a combination of kind of people coming to Gonzaga and our students really, you know, going after those opportunities. In terms of shadowing opportunities, similar. There's just a lot of opportunities. We also have an alumni network that runs out of our office, that alumni mentoring program. So students can connect with people that are in grad school and then also practicing and connect with them and get mentorship and hopefully lead to some shadowing opportunities based on kind of the relationship that they're building. So those are things that I have. I'm sure you have things as well.
Yeah, I'll just give some like really concrete examples of what my students are doing in the area. So there's not a lot of, I shouldn't say not a lot, but these opportunities for shadowing or jobs or getting experience, they're not necessarily formal in a sense that we arrange them for students like Gonzaga or the programs arrange them. So it's kind of up to the student to pursue those. But for example, a lot of my students, they get certifications, like they take some courses outside of Gonzaga to be a medical scribe. And then they start working at Providence or Kootenai Health and scribing in the emergency department on weekends or evenings, something like that. There's a lot of, they get medical assistant jobs. The other one is it's not a nursing, Katherine, help me out with the
CNA, certified nursing.
Say that again, CNA?
Certified nursing assistant.
Yeah, I can never remember it. But a lot of my students are CNAs and they're working at retirement centers or nursing homes. And they're getting their feet wet in the health science career, the medical field that way. In addition, I have students that when they go home in the summer, they'll take an EMT course. It's usually like I think a 4, 6, or 8 week program. And then as a junior and senior, they're actually sometimes on the evenings or weekends, they're working as EMTs in the local area. And they're doing ride-alongs and they're getting great experience. So it's all over the place. And then there are just companies in and around campus. For example, there's a physical therapy company called U District right off our campus, and they love our students. Many of our students are going over there, working at the reception desk or working as physical therapy assistants. So the local companies really love the Gonzaga students, and we tell our students to utilize that leverage. Say, hey, I'm a Gonzaga student, I'm looking for a job. What type of opportunities do you have? And there's no shortage of opportunities in the area.
Awesome, thank you. So we are getting some questions about the admission process and some scholarship information about Gonzaga. I'd just like to say we are offering both an application process and financial aid information session as part of preview day at 1 p.m. Pacific time. So love those questions. Please be sure to attend that part of preview day back in the main Zoom room after this is concluded. But we would really like to keep this focused to the health sciences as we have our experts here for just about a little bit over 5 more minutes. So if you have questions specifically about health sciences at Gonzaga and different opportunities, please keep those coming. If you have your admission, scholarship, or financial aid questions, very much encourage you to stick around till 1 p.m. to hear from the admissions office on that. No other questions right now. Do we have any other? I know Katherine said you might have some other slides with information for the students or any last remarks. Like I said, we have a little bit over 5 minutes. So if students do have questions, please get them in the chat right now or unmute yourself and ask them out loud.
Yeah, I can kind of go through a little bit of the content that we have. And yes, if you have more questions that this is generating, and I'll also share at the end how you can get in touch with us as well. So I just wanted to share some campus resources. Some of these we've already talked about or alluded to. So some of the campus resources that are available that support students in the health sciences. So we've mentioned a lot about our faculty advisors. We have a committee on health science careers that supports students as well, oftentimes as they're getting really close to applying for those medical and dental schools. We've got, Writing Center, academic advising, Center for Community Engagement, really helps students with finding service opportunities in the Spokane area, and service is a really important part of the Gonzaga experience, and also something that, for people going into health professions fields, kind of developing that compassion and that heart for helping others. And that's something that really stands out for our students that are applying to medical and dental and all of those health professions fields. That stands out for Gonzaga candidates is the amount of service that they're engaged in. And so our CCE office is really helpful for students in finding those type of opportunities. We also have great leadership experiences. Our comprehensive leadership program is a really structured way for students to get leadership experience that leads to a leadership minor. But I mentioned we have some really strong pre-health clubs. So those are listed here, but we have, I think, hundreds of clubs on campus for students who are interested in everything from, outdoors activities to, we have different cultural clubs on campus. We have probably like some arts clubs on campus. Sophia, I'm sure you're probably involved in a couple of clubs on campus. So lots of great opportunities for our students to get involved, build community, build leadership opportunities and skills as well. And then I wanted to also share, this is just a list I was talking about all of the different graduate programs that are in the Spokane area. So this shows between Eastern Washington, which is about 30 minutes from Spokane, Whitworth University, which is just up the road from us, Washington State, which is just kind of across the river from us. And then Gonzaga also has some kind of health related programs. We have some advanced nursing programs, and then also some counseling programs as well. And then this is how to get in touch with us. So our H3P website, again, has a lot of really great information. So that's our website. You can send us an email at h3p@gonzaga.edu. There are a couple of us that check that email. So if you have questions that you didn't get around to ask today, or you're on our website and have a question that comes up after that. And then this is our human physiology website. And Dr. Thorpe is our chair of that department. So I listed his contact information, but Dr. Crosswhite's information is here as well. So you can email him with questions. You can email me with questions, Dr. Measor, who wasn't able to join us today. You could email us as well. Lots of different ways to reach out to us if there was a question that we didn't get to today.
Awesome. Well, we do have about 3 more minutes before the academic sessions are over. So if anyone has any questions, please feel free to unmute yourself and ask them out loud. But then I might pull on our panelists for any last minute pushes that you'd like students to know as they're going through this college search process, or I know we have some seniors that are going through the college application process, and then eventually we'll be deciding.
Yeah, one thing that I always like to emphasize is, in today's session, we've really talked about postgraduate plans, graduate school, professional school, jobs. I always like to emphasize, don't forget about the 4 years that you're going to be, at Gonzaga or somewhere else. Really, you want to, find a path, a route that is your own, make it your own, and really enjoy it. Because those 4 years will be very, very important and also just impactful on you as an individual the rest of your life. So slow down, take some time to enjoy it while you are in college, and don't think about just the majors as a means to an end to a job.
One thing that I always leave my tours or academic sessions with is whatever it is that your passion is, just follow it, because there's always time, there's always ways that you can add an interest to the pre-health world if you're interested in it. Like for me, I mean, women's and gender studies and religious studies are some of my passions, but I'm still finding ways to incorporate those, and they actually help me kind of enrich my own lens within the healthcare setting. Like working as a receptionist, I now think about these other perspectives that I'm learning in class because I'm passionate about those things. So don't be scared that it doesn't fit the health science box, or that it doesn't fit what a pre-health student looks like, because I mean, we all come in different shape sizes with different passions, and different interests, and all of our journeys are so different. Some of us, it takes 7 years to get there. Some of us know exactly what we want to do when we're here. But one thing I wish I had done when I was my first and second year was, if you meet an older student who is doing something that you kind of see yourself interested in, ask them, because they have been through the process. They are the student who has talked to advisors, they've taken the classes, they've talked to professors. So ask them for advice, because they honestly will have a really great student perspective and will be answering questions that you didn't even know you had. And plus, we love talking about what we're interested in. So just ask us any questions if you ever have a chance to talk to an older student.
Awesome. Thank you all so much for joining us. It is 12:10. You have about a 10-minute break before our student panel begins in the main Zoom session. So you are free to go from our academic sessions. Thank you so much to all of our panelists for taking time out of your Saturdays to connect with our prospective students. I hope you all have such a great day. And then again, for our students participating in preview day, you have about a 10-minute break before our student panel will begin.